Hi, it's Paul Feuerstein, Technology Editor of Dentistry Today. And today I'm here with Zack Burkett. Zack, how are you?
Good, how are you?
And Zack is with Tokuyama. And Tokuyama, as you probably know, is a very fabulous restorative company. But let me talk to you a little bit about composites. As a GP, I see composites coming to me all the time.
I bet.
I get new composites, and these are the latest and the greatest, and this one polishes better, and this one has better properties, and this has this, this has that. So they say, Dr. Paul, why don't you do this? Let's send you some samples, or you can buy a little sample pack. What shades do you want to use? I said, well, I usually use A2 for most things, and sometimes A1, maybe A3, maybe A4. So I get this box that's about this big with all sorts of different colors and things in it. And then what we do is, the patients love this, by the way. When you do a restoration, you take an old amalgam out of the tooth. I always take an intraoral picture of it. Then I take a picture after we put the composite in, and they go, oh my God, I have a white filling. And they have this nice tooth with this like A1 filling or A2 filling. Every once in a while I get real lucky, and there's actually a color match, and you can actually see like a blend across, and they go, oh, my tooth looks like a real tooth. Why can't we have a chameleon material?
Well, I would say that now we do.
Okay.
I think our new Omnichroma Universal Composite is a truly one-shade universal composite that'll match almost every patient from A1 to D4. So now you don't have to worry about getting lucky and having used the right shade. The composite will actually change on its own to what the patient's natural tooth color is.
And so I heard about this and talked to you earlier, and you said, try it. You sent me a couple of samples. I got some samples. Tried on a few patients, which I'll send you the photos of. And it was an eye-opener, literally. It just melted into the tooth.
Yeah, we think it's a total game changer. I mean, as you know, composites haven't changed much in decades.
Yeah.
They've relied on similar technology. They've gotten a little bit better at polishing, or they've gotten a little bit better at flexural strength and things like that. But the core color technology has been the same for so long, and we've totally changed that with a new type of technology that allows it to just change to whatever the patient's surrounding tooth is.
And there's a tiny bit of technique involved here. So why don't you just go through it.
So the beautiful thing about it is that it is just a tiny bit of technique. You can use this pretty much the exact same way that you use any other universal composite. The only things that we stress a little bit more are bevels and chamfers to your preparations. That's going to help ease the shade matching in. A lot of doctors are already doing that, so that's a very easy step. For most cases, that's all you have to do extra. It works with most bonding agents, 2 millimeter increments, light cure, done.
What if I have an extremely dark tooth or some old stain from old amalgam inside the prep?
So we do have a supplementary product called Omnichroma Blocker, which you would want to use first to block out that discoloration to make sure that Omnichroma is getting as close to the true match of the patient's tooth as possible and not picking up that dark amalgam color. That Omnichroma Blocker is also used for really large anterior cases. Omnichroma, of course, works by adapting to the surrounding tooth color. So if you don't have surrounding tooth, that's a bit of an issue. So you actually build out a lingual side first.
And you actually showed me a case like that. It was really nice. It was a patient that lost half their incisal. And I said, this is going to be too translucent. He said, aha, not really. So they backed it a little bit with with the blocker in the back. It was a fabulous case. You should publish that somewhere.
We're working on it. It's the most impressive case I've seen. But yeah, the awesome thing about that, though, is that it's not just KOLs or experts who are telling me that the product is great. We're getting constant good feedback from normal doctors on the ground who are just...
Well, there's nothing, it's something we don't take it for granted. We're putting it in a restoration, and we know it's going to be a white restoration. This is not a white restoration. This is the tooth colored restoration.
Exactly.
That's the real difference. The funny thing is, unfortunately, the patients don't get it sometimes. They go, oh my God, I have a white tooth. I mean, but we know, I have to say, as dentists, we stress ourselves out sometimes. When we do crowns sometimes, we'll say, on upper second molar, we'll say, hey, can you stain the gingival a little darker? I mean, it's for us. But this actually works for both sides, because the patient looks in and says, not that I have a new filling, I have a new tooth.
Yeah, you have a new tooth.
That's the response that we've been getting, and that's been really remarkable.
Yeah, and not only will it match to the patient and create that new tooth look, but as you know, a big limitation for composites for years has been bleaching or color change of the patient's tooth.
I never thought about this.
And so what's really cool about our product is that because it's able to shade match and it's continually doing this through the lifetime of the restoration, if the patient decides to go through a bleaching process, the composite will actually lighten to the color of the surrounding tooth.
I did not know that, because a lot of times my patients will say to me, have a lot of anterior composites. Are they going to change? And I say, no, I didn't know this.
Yeah,
Oh,
that's because
fantastic. Yeah, yeah.
most composites have dyes and pigments that make
Sure.
them a certain color, and we don't have any of that.
Oh, you have some sort of refractive magic in there.
Yeah, structural color technology that doesn't rely on any dyes or pigments at all, so it's able to adapt to anything.
That's big. That's big. So, if a dentist is looking to get to know more about the product, I know you have a website, Tokuyama-us.com. Where else can they get information from their representatives, or from how would that go?
Yeah, so they can reach out to us directly. Our direct phone line is 760-942-7211. We have a lot of excited people that would be happy to talk to you. But we also have a website dedicated solely to the Omnichroma product. So if you go to omnichroma.com, you can actually request a sample online. It has our technical report, it has evaluations, testimonials, case images, pretty much everything. So omnichroma.com,
Gotcha.
and go from there, and you'll pretty much be able to figure everything out from there and see just how great this product is.
But they should know about the other products that you have also, but that's
Of course.
okay. That's okay. We'll press on this for now.
Yeah.
Zach, what a pleasure. Always
Thank you
good
so
seeing
much.
you.
Good to see you too.
Thanks a lot.